Symmetrical head. Then I'm gonna palpate the scalp. Feels normal. Hair normal. Okay. I'm just gonna touch the temporal artery. Okay, and then I'm gonna ask you to open your mouth. Close your mouth. Okay, no clicking. I'm gonna ask you to open your mouth again, and then move your jaw side to side. Okay, seems normal. Okay. I'm just gonna move your hair here so I can look at your neck. Okay, no visible signs of scarring or lumps. Okay, I'm gonna ask you to swallow once. Okay, looks good. Okay, now I'm gonna have you look right to left, and when you look right, touch your ear. When you look left, touch your ear to your shoulder. Look right, touch your ear to your shoulder. Look left, touch your ear to your shoulder. Okay, looks good. Okay. Then I'm just gonna feel the notches of your neck. Make sure everything feels right. Okay. I'm gonna come behind you. Take it over. Okay, trachea is midline. Okay, so now I'm just gonna check your lymph nodes. Okay, I'm gonna start back here. There's a lot of them. Okay. There's no tenderness when I do that? Okay. There's no lumps. This side. Okay. And then I'm just going to take a look inside. So there's some earwax, it's normal. Okay, same with that one, looks good. Okay, now I'm gonna whisper something in your ear and let me know if you can hear it or not. Cat.
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 Oh, cat.
What is that?
Cat.
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 Okay. And now I'm going to hold this up to your ear and let me know when you can't feel it anymore. And then when you can't feel it, I'm going to ask if you can hear it.
I can't hear it. I can hear it.
Okay. I'll do it on this side.
I can't hear it.
I'm just gonna do a similar test where I hit this again, and I'm gonna ask you if you can hear it equally on each side.
I can hear it equally in both ears.
Okay. Okay, now we're gonna go and inspect your nose. Okay, it's symmetrical. I don't see any lesions. Now I'm gonna have you close your nose and see if you can breathe through each nostril clearly. Are they both clear? I'm gonna feel your nose and see if there's any tenderness. Do you feel any tenderness?
No.
Okay. Same thing with your sinuses. So let me know if you feel any tenderness.
No tenderness. No.
Okay. First, I'm going to look at your mouth. Hello. Okay. Everything looks good. Do you want to say ah? Ah. Okay. Okay, now we're going to look at your eyes. I'm going to take this chart and I'm going to hold it up 20 feet away. I'm going to have you cover one eye at a time. Have you read line by line and then let me know when you can't read it anymore. We're going to start with your left eye. First line.
FP.
Second line.
TOZ.
Third line.
LPED. PECFD, EDFCZP, FELOPZD, DEFPOTEC, LEFODPCT.
Perfect vision. Okay. I'm going to do your right eye.
FP, TOZ, LPED, PECFD, EDFCZP, FELOPZD, DEFPOTEC, LEFODPCT.
Okay, I'm going to have you look. I'm going to have you look at the pen line, wherever I move it. Okay. Okay, I'm going to move this in front of your eye, and I want you to keep looking straight at me. Not at the light, at me. Okay, and then same thing with this eye. Okay. Okay, I'm going to have you cover your right eye, and then I'm going to have you look at my finger, and then I want you to uncover your eye and keep looking at my finger. Good. Now can you do it with the other side? And then uncover. Good. Okay. I'm just going to look at your pupils. So I'm going to have you look at that sign over there, and then when I tell you to, look at my hand. Okay, ready? Look there. Now look at my hand. Good. Just going to look at overall. Your eyes look healthy and symmetrical. Okay, now I'm gonna look in the inside of your eyes, lacrimal ducts, down here, touch up here. Okay, looks healthy. And that's all.
Thank you. To the table. Perfect. And we're going to start with wrist extension. So just go ahead and bring your knuckles towards yourself. Awesome. Any pain? Nope. Perfect. One more time. And hold on, let me move you, okay? And that'd be a grade 5. Go ahead and flip your hand over for me. And we're going to do the same thing for wrist flexion. Go ahead and bring your hand towards yourself. Any pain? Nope. Hold on, let me move you. Awesome job. That's a grade 5. And we're going to do the finger flexion while you're there. So just go ahead and bend your fingers up like this, fingers straight. Any pain?
No.
Awesome. Hold on, let me move you. That'll be a grade 5 as well. Flip your hand back over for me. We're gonna do finger extension, so go ahead and make like a claw for me. Any pain with that?
No.
Okay, hold on, let me move you. That'd be a grade 5. We're gonna start with our hand flat on the table. Go ahead and spread your fingers for me and lift them up off the table. Great job for finger abduction. So I'm just gonna try to push your fingers in towards midline. Don't let me, okay? 4 there, a little bit of a give. 3 there, it gives pretty easily. Middle finger can go both directions, so that's about a 3. Oh, stronger, there's a 5. And 5 for index finger as well. We're gonna do finger adduction next, so go ahead and put those fingers tight together. Try to hold them together for me, and I'm gonna try to pull them apart. That's a 5. 4 there, a little bit of give. And that's a 5, nice and strong. Next, we're gonna do thumb opposition. So go ahead and touch your thumb and pinky together. Any pain with that?
No.
Perfect. I'm gonna try to pull you apart. Don't let me, okay? Grade 5 for that as well, nice and strong. And next, we're gonna get up on the table, and if you don't mind taking your shirt off for me, that'd be great. Gotta get my thing to kneel on. Can you scoot forward a little for me?
Yeah.
We're gonna start with scapular elevation. So can you bring this shoulder to your ear for me, please? Awesome. Any pain with that?
No.
Perfect. One more time. And hold on. Let me move you. Grade 5 for that. We're gonna do shoulder flexion next. So just bring this arm all the way up forward by your ear. Any pain with that?
No.
Okay. Do that one more time for me. And stop about halfway down. Hold on. Let me move you. Grade 5 there. We're gonna do the same thing out to the side, all the way up to your ear and all the way back down for shoulder abduction. Any pain?
No.
Awesome. One more time for me, about halfway up. Hold on, let me move you. Great job. That's a grade 5. We're gonna do scapular abduction and upward rotation next. So if you can just put this arm out at a 45-degree angle towards and punch towards the ceiling. Awesome. I'm gonna try to move your scapula down and backwards. Don't let me, okay? Awesome job. Grade 5 for that. And, sorry, get this out of your way. We're gonna do elbow flexion next. Can you go through this motion for me? Any pain?
No.
Okay, all the way back up again. Come off just a little bit. Hold to let me move you. Awesome job. That's a grade 5 as well. And next we're gonna do pronation and supination. So just go ahead and go through this motion for me. Any pain with either of those?
No.
Perfect. We've got full range of motion for pronation and supination. We'll start in pronation, so there you go. And hold on, let me move you out of this position. That's a grade 5 as well. Flip over. Hold on, let me move you out of this position. Grade 5 for both pronation and supination. We're gonna move down to lower extremity now. So for hip flexion, can you scoot back a little? Awesome. Go ahead and lift your knee up off the table for me. Any pain with that?
Nope.
Awesome. One more time. Hold on, let me move you. Great job. Solid grade 5 there. We're gonna do hip internal and external rotation next. So for hip internal rotation, we're gonna bring this side of our foot just out this way for us. Any pain with that?
Nope.
Perfect. Hold on, let me move you. And that's a grade 5. For hip external rotation, we're gonna do the exact opposite. So in this way. Any pain?
No.
Do that motion one more time for me. Hold on, let me move you. And that's a grade 5 as well. Next, we're gonna do knee extension. So just go ahead and kick that leg out straight for me. Any pain?
Nope.
Okay. One more time for me. And just back off of that just a little bit. Okay, hold on, let me move you. That's a grade 5 as well. We're gonna move down to the ankle next. So we're gonna do ankle dorsiflexion. So go ahead and bring your toes up to the ceiling for me. Any pain?
Nope.
Go ahead and bring this in just a little bit for me, and I'm gonna try to push you out of that position, okay? Hold on, let me move you. Grade 5 for that as well. We're gonna do Taylor Inversion next. So try to bring the sole of your foot up towards the ceiling. Any pain?
No.
Okay, hold on, let me move you. Awesome, that's a grade 5 as well. We're gonna do eversion next, so just the opposite direction with the bottom of your foot. Any pain?
No.
Okay, hold on, let me move you. Grade 5 for that as well. Next, we're gonna do great toe flexion and extension. So just bend your big toe for me all the way in. Any pain?
No.
Hold on, let me move you. Awesome job, that's a grade 5. Go ahead and extend your toe for me. Any pain?
No.
Hold on, let me move you. It's a grade 5 as well. And next I'm gonna have you lay on your back for me, please, and we can use this as well.
Thank you.
Comfy? Yeah. Perfect. So first we're gonna do cervical flexion. So I'm gonna just have you bring your chin to your chest without lifting your shoulders off the table. So I'm just gonna hold these for you. Awesome, any pain?
No.
Perfect, one more time. And I'm gonna apply some pressure to your forehead, okay? Hold on, let me move you. Awesome job, that was a grade 5. We're gonna do horizontal adduction next. So go ahead and put your arm in an L over here and bring it like so. Bring it across your body. Any pain with that?
No.
Okay, come back just a little bit. Hold on, let me move you. That's a grade 5 as well. Next, we're gonna do trunk flexion. So I'm just gonna hold you down here by your legs and you're gonna sit all the way up, arms up by your ears, okay? Great job, that would be a grade 5. And for trunk rotation, are you okay? For trunk rotation, we're gonna do the same thing, just bring your left elbow over here by your right knee, okay? Same thing. Or that way works too. Sorry, it's all right. And that's a grade 5 as well. So next we're gonna go into sideline, face the wall for me, please. Awesome job. You can bend this bottom leg to stabilize if you want. And we're gonna lift this leg all the way up as high as you can. Any pain with that?
Nope.
Back down and back up, please. And hold on, let me move you. That's a grade 5 for hip abduction. So for adduction, we're gonna test the other leg just to kind of save some time so she doesn't have to flip back and forth. So I'm gonna hold this leg for you, straighten this leg out, and try to bring this leg up to this leg. Awesome job. So she's got full range of motion. One more time and I'm gonna apply some resistance, okay? Hold on, let me move you. And that's a grade 5 for that as well. Awesome job. Okay, so next I'm gonna have you flip over onto your stomach. This chair's out of my way. Okay, we're gonna do cervical extension next. So can you just go ahead and without lifting your shoulders off the table, lift your head up off the table for me? Awesome job. Do it one more time and I'm gonna add some resistance. Hold on, let me move you. Grade 5 there as well, nice and strong. We're gonna do trunk extension next. So with your hands on the back of your head, I'm gonna stabilize back here for you and go ahead and try to lift your chest all the way up off the table. Great job. That's a grade 5 as well. We're gonna do shoulder extension next. So go ahead and put this arm out straight behind you. Both of them's fine. And lift this hand up to the ceiling and hold on, let me move you. Grade 5 there. And next we're going to do shoulder internal and external rotation. So if you can go ahead and hang this arm off the edge of the table for me, that'd be great. So for external rotation, you're gonna bring the back of your hand up to the sky. Any pain?
Nope.
Okay, one more time through that motion for me. And hold on, let me move you. Awesome, that's a grade 5. So for internal rotation, we're gonna do the exact opposite. Palm to the ceiling. Awesome job, and hold on, let me move you. Gave a little bit, so that would be a grade 4. We're gonna do horizontal abduction next. And go ahead and right out here, we're gonna lift our elbow straight up to the ceiling. Hold on, let me move you. Can you go ahead and put your hand straight down for me? And hold on, let me move you. That would be a grade 5 as well. And we're gonna do elbow extension next. So if you can just kick this arm straight out for me. Any pain with that?
No.
Okay, one more time. And don't lock out your elbow, just flex just a little. Okay, hold right there for me, okay? Hold on, let me move you.
Did you accidentally summon me?
Yes, Siri, I did. Okay, sorry, one more time. Hold on, let me move you. And that's a grade 5 as well, awesome job. So, on to scapular motions. We're gonna do scapular adduction and depression. So if you can bring this arm up just straight like Superman, and if you can thumb up, lift your hand up towards the sky for me. Any pain?
No.
Okay, one more time for me. And she gives pretty quickly, that's a 3. And next we're gonna do shoulder adduction and downward rotation. So you're gonna put this hand on the small of your back, and you're gonna lift this hand straight up to the sky for me, okay? Any pain?
No.
Okay. One more time for me. Hold on, let me move you. Gives a little bit, that's a grade 4. And next we're going to do shoulder adduction. So go ahead and make a field goal with this left arm for me. Awesome job. So lift just your whole entire arm up to the ceiling. Any pain with that?
No.
Perfect. One more time. Hold on, let me move you. She gives a little bit, so that would be a grade 4. We're gonna do hip extension next. So if you can go ahead and lift this leg up to the ceiling for me, I'm gonna stabilize right here at your low back for you, okay? Any pain?
No.
One more time. Hold on, let me move you. That's a grade 5, pretty solid. And then we're gonna do knee flexion as well. So if you can bring this leg up for me. Any pain?
No.
Okay, one more time through that motion for me. And hold on, let me move you. Grade
We'll do it
5
one more
there
time,
as well. Can you put your hands up by your head for me? Okay. And lift your chest up off the table for me. Perfect. Great job. That would be a grade 5. And our last one is going to be in standing. I just came on over here. And we're going to be testing for plantar flexion. So if you can go all the way up on your toes as high as you can. Oh, it's hard with the bun. Okay, and go back down. Pick a foot, doesn't matter which one. You would normally test for both, but we don't have time for that. Okay, and go up as high as you can on one foot. We're gonna try for 25 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, and 25. Awesome job. That would be a grade 5.
Can you clench your jaw?
Thank you.
I'm just feeling your masseter muscle here in your cheek and your temporal muscle in your forehead. And can you just open against resistance? Very good. Okay. Next, I'm just palpating your temporal arteries. There are +2, which is moderate. And I'm just palpating your temporal mandibular joint. Can you open your mouth and move your mouth side to side? Okay, and there's no crepitus or hardness with movement of that. Next, we're going to take a look at your eyes. I want you to just follow my finger with your eyes. Okay, and you have parallel movement of your eyes. And then I'm going to have you turn towards me. Can you cover your right eye? Just tell me when you see my finger coming in, okay?
I see it. See it. I see it.
Okay, and then switch eyes.
I see it. I see it. I see it.
Okay, and then you just have no peripheral vision loss. All right, after that, I'm just taking a look at the outside of your eyes. There's no drainage or redness noted and no increased tears. I'm going to take a look at your pupils as well. Just look forward for me so your pupils dilate. Okay, and your pupils are 4 millimeters in size before the light, and then 3 millimeters after the light is shown on them. They're brisk, equal, and reactive to light, and you have a direct and consensual light reflex. Next, we're just going to test accommodation. I just want you to follow my pen as it goes in towards your nose. Okay, and the patient has accommodation. Next, after looking at your eyes like that, we're going to look at the fundus of your eye using the ophthalmoscope. I would put the ophthalmoscope up to your cheek on the side and look in and kind of stabilize your head as I look. First, we would see the red reflex as we go in with the ophthalmoscope. That kind of helps guide our vision to the fundus. The fundus will be a light brown, a light red to brown red color. The optic disc will be a creamy yellow pink color. The macula will be darker than the fundus and 1 diameter in size compared to the optic disc. The cup in the optic disc should be lighter and smaller than the optic disc itself, and your arteries and veins should be paired, and they should go out to each quadrant in the eye, and they should be in both eyes. Next, we're moving to your ears. When we look at your ears, we just note that they're symmetrical and there's no redness or lesions or any excessive drainage coming from them. I do see some earwax on this side and on that side, but that's normal. Then we would take the ophthalmoscope, the otoscope, and look inside your ear. I would pull your pin up and back and peer in, and then when we look at your eardrum and your tympanic membrane, it should be a shiny translucent color, pearl gray. On the left side, you can see the light reflex at 7 o'clock, and then on the right side, same thing, your tympanic membrane and eardrum should be that pearl gray color, and then you can see the light reflex on the right side at 5 o'clock. And then we wouldn't see any perforation of the tympanic membrane. Do you have any difficulty hearing?
No.
Okay. So I want you to cover your ear with your finger, just your finger like this. I'm going to come in on this side, and I want you to repeat the words that I whisper.
5C6.
Okay, and I'm going to come to this side and just repeat the words again.
433.
Okay, very good. All right, and then that means you just have no hearing loss. We would also check for hearing loss with the Weber and Rhine test. We would use a tuning fork. I don't have one, so I'll just explain. For the Weber test, the tuning fork would go on top. After you hit it, the patient should hear the sound equally in both ears. And for the Rene test, you test air and bone conduction on the mastoid process, air conduction next to the ear, and then the patient should hear the sound longer through air conduction than bone conduction. After we assess the ears, we're going to go down to the nose. I'm just assessing the symmetry of the nose. It's symmetrical midline, and it's in proportion to the rest of your face. Any pain when I touch?
No.
Okay. We're just going to assess cranial nerve 1. Can you tell me what you smell?
Vanilla.
Okay, good. And then if we looked into the turbinates and the nasal mucosa, picking up the nose like this on each side, the turbinates and the nasal mucosa would be a light red color, and we shouldn't see any nasal polyps. All right, I'm just going to assess your sinuses as well. And then do you feel any pain with that?
No.
Okay, you should feel no pain, just the pressure itself from that. Next, we're going to go down to your lips. I see that your lips are a nice pink color and there's no cracks. Can you stick out your tongue for me? Okay. Can you move your tongue side to side? All right, and that just assesses cranial nerve 12, that it's intact. Stick out your tongue again for me. The tongue is nice and pink. You do have some white on it, which is normal. It has a little bit of a appearance from papillary as well. Can you pick up your tongue? Okay, and looking at the tongue, you see that it's pink, moist, and you see the veins on the ventral side of the tongue. I'm going to take a look at your gums too. Gums are nice and pink. Pink coral with a stippled appearance, which is normal. Can you smile for me? Your teeth are nice and white and straight. And then if you smile, I'm going to take my tongue depressor and look back, bite down. You see that the teeth on the top and bottom are aligned in the back. And in the front, the top teeth slightly come forward, which is normal. Taking a look at the buccal mucosa. It's nice and pink and moist on both sides. I don't see any lesions or ulcerations throughout your mouth. Next, I want you to say ah for me.
Ah.
Okay, and you see the uvula move up, testing cranial nerves 9 and 10. I'm going to elicit your gag reflex, and that also tests cranial nerves 9 and 10 when it's intact. Your hard palate is wider compared to your soft palate, which is a smooth pink texture. And then just looking back more on your tongue at your pharynx and your tonsils, I see no exudate in your pharynx or your tonsils, and your tonsils are a +1 in size. Next, we're going to move down to your neck. Can you move your neck side to side? And then up and down to your chest. And then can you try to press your head to your shoulder without moving your shoulder, and then the other side. Perfect. So with that, I didn't see any noticeable lesion when the patient was moving his neck, and his range of motion is intact. I'm going to just assess your lymph nodes. The preauricular with gentle palpation, the postauricular, occipital, the submental, submandibular, jugulodigastric, superior cervical, deep cervical chain, posterior cervical, and supraclavicular. And with that, we feel no enlargement. Can you tilt your head to the right for me? And take a sip of water. And then tilt your head to the other side. And take a sip of water. And with that, you feel the thyroid gland move up and down. Next, I'm just going to assess your carotid artery. One at a time. It's a +2, which is a normal pulse. and we're just going to assess for any roots. Can you take a breath in and out and just hold the breath out while I assess for any roots in your carotids with the bell of my stethoscope? In, out, and hold it. Just hold it. Hold the breath out. Okay, and no roots there. And then same thing on this side. Hold the breath out, okay? And no roots with that as well. Okay, next we're just going to move down to your posterior chest. I'm just going to turn you this way so we can see. With this, you see the diagonal slant of the ribs. There's no lesions or anything. The skin is nice and warm and intact like the rest of this patient's skin. And his AP to transverse diameter is a 1 to 2. We're just going to assess your chest expansion around T9 to T10. Can you take a deep breath in and out? Okay, and you can see that it moves symmetrically. All right. I'm just going to also test for tactile firmness. I want you to say the word 99, and I'm going to move my hand. And each time I move, you say it.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
And the vibrations are strong and symmetric on both sides. We're also going to percuss down on each side. And you hear resonant sounds on each side. I'm also going to auscultate for 1 full respiration in each area of the lung. All right, and then can you take a deep breath in and out for me? One more time, right there, sorry. Okay, wonderful. And now we're going to turn you towards the front. And then same thing, we're just inspecting the chest in the front again. Again, his AP diameter is 1 to 2. AP to transverse diameter is 1 to 2. The patient in the back and in the front has no accessory muscle use. His respirations are regular and even with symmetrical chest movement. We're going to chest expansion again. Breathe in and out. And you see movement of that. We're also going to assess for tactile firmness here. So can I have you say the words 99 again?
99, 99, 99, 99, 99, 99, 99, 99.
Okay, and we're going to percuss in these areas. Okay, and then same thing, you hear the vibrations with tactile firmness and you hear resonance with percussion. You can hear dullness of the heart and the liver note in the front. And then we're going to listen to your breath sounds. Take a deep breath in and out. Okay, all right. And then the last thing I'm going to do, Michael, really quick, just before this ends, is just test for any costovertebral tenderness, and just tell me if you feel any pain when I do this.